morning, Dr. Graw.
Morning, Dr. Coleman.
I'm seeing this very interesting young man that I'd like to ask your help with. He's had some symptoms recently of nighttime cough and some shortness of breath with exercise. When I examined him, I really didn't hear any wheezing, but I was concerned because we did a peak flow on him and it was lower than what we would expect for his age and his height. I went ahead and gave him an albuterol nebulization treatment, as a bronchodilator, and he's a little bit better, but I think, maybe you can help me with what the next steps might be in taking care of him.
Good. Does he have any family history of asthma?
He doesn't have a real specific family history of asthma, but there are some members of the family have shortness of breath when they're exposed to animals or dust.
And how about exercise? Is he playing sports or does he do anything that aggravates it?
He's an outstanding athlete and he does have some shortness of breath with exercise. His mother tells me that he's done very well so far and has a real bright future. So I think we need to get on top of this.
Good. Well, let's have a look at him. Down here?
Yeah, let's go down this way. Well, hello again.
Hello.
I brought Dr. Graw with me. Dr. Graw, meet AJ.
Good morning. How are you? Nice to see you. Dr. Coleman tells me that you've been having some trouble with coughing.
Yes.
Have you noticed any problem when you've been running?
Yes. I'm running up and down the court in basketball, and I can barely make it up the court without coughing.
And did this help when you got your treatment?
A little bit better.
Let me have a listen and see what's going on. Try to take a deep breath. Okay, try to take it a little slower here. Let me see what I hear. Well, I can certainly see that there's some wheezing going on. You said there wasn't a lot of wheezing to start with?
That's right. When I first listened, there was no wheezing there, and that's when we decided to do the peak flow test, and then we decided to do the nebulization treatment. So clearly this has made a difference, that we can hear wheezing now when I couldn't hear it at first.
I think what happens is that you finally get so tight, the bronchial trees get so tight that you can't get the air in and you don't even hear a wheeze. As you get the medicine, which dilates the bronchial tree up, then the air can get in and pretty soon you start hearing the wheeze when you go in and then when you go out. When you start breathing in and that bronchial tree is tight, then it coughs. So it starts, you start taking the air in, and you can't get it all in, and then and what you do is you cough to get all the old air out to make space for the new air to get in. So obviously we're going to come up with some treatments that might be able to help you. What is this?
Well, I think it's a good diagram that you could use to explain what you've been talking about.
You're right. I think this is the kind of thing that would help AJ and his mom understand. So let me just show you here. Here's where the air comes in. It gets into these tiny little bronchioles. These are the air sacs in the end. You might want to look at this. This will help you understand exactly why he does the coughing when he does that. This nebulizer is the first treatment. This little apparatus that you use to measure your lungs volume, the peak flow, is something that you can do at home. We're going to get your private doctor to teach you about using something like a peak flow. And then you can monitor how you're doing yourself. It's like a gas gauge. You'd get up in the morning, you do a little peak flow test, and then you say, my lungs are good, or I might need to take some treatment. Let's see you do that. Let's see how you take a peak flow. Let mom hold your nebulizer tubing there. Sit up straight, throw your shoulders back, put your hand, okay, and that's a pretty good number compared to where you were before. You're already moving more air in. Let's have you try and do it one more time. Slow down. Deep breath. You can see how much higher it is than before. You can see that this is a good way for you to see how your lungs are working. And then when you give treatments at home, whether it be with a nebulizer or inhaler, you can measure the effect. By the time you see your private doctor, then he'll be able to look at it and he'll be able to figure out exactly what it is you need to do on a regular basis. This is great. We'll give you that to take home. The other thing I'm thinking you might need, we can give you one of these nebulizers, but I think if you walk on the basketball court with that today, they're going to be upset, right? But I'm going to give you a little inhaler. These little inhalers are the same medicine. It's not quite as big a dose, okay? But you can take this yourself, and you can take it before you play basketball. We'll teach you when to use it, but I want to teach you how to use it now. The most important thing is to shake it, okay, to make sure that you get all the chemicals mixed up with the aerosol. When you use it, you need to empty your lungs, so I'm going to teach you about that. You blow out, keep the inhaler about 2 fingers in front of your mouth, and as you breathe in, you push down on the inhaler. You see how that medicine comes out? That medicine right there is what goes into your lung. So you want to get a good, clear puff into the air that's going into your lung, not into your mouth. You'll see a lot of people put their mouth on the inhaler mouth, right? They'll put their lips here, and then when they do that, all the medicine ends up right in your throat, and that's not where it's going to help you. So you want to be able to blow out, and then as you breathe in, you go, and then hold your breath, hold your breath, hold your breath. Now let's try to see if we can do it. Sit up straight. Perfect, absolutely perfect. Now you just hold that, and I'm telling you, in a couple of minutes, you're going to feel as good as after that nebulizer. Now just let it out now. You feel how it sort of releases everything a little bit in there?
Yes.
I think you're going to be in good shape, okay? Good, thanks for coming by.
Well, Dr. Groth, thank you. I think that was very good.
I think the understanding of how the lungs function, using the peak flow to measure that lung function, the use of the inhaler, tied together with his primary doctor will keep him healthy, and he'll continue to be a great athlete. You know what we say?
An apple per day. Stay healthy.